Hey, it's Dominique Well from Well Medical Arts, and we have this beautiful young lady who is interested in a lip consult. So what I wanted to start out doing was by teaching her about the anatomy of the lips. So around the border of the lips is called the vermilion border, and you'll usually see a little bit of pink. On top of that, you see a little bit of white, and that's frequently where people will use a little bit of highlighter. The white is called the white roll. This up at the very top is called the Cupid's bow, and then from the peak of the Cupid's bow up towards the nostril, these two things are called the philtrum, and then right in between the philtrum, she has a beautiful tear-shaped indentation. And then drop your bottom jaw open a little bit, just a little bit more. There is an area, this is the dry part of the lip, and that is the wet part of the lip, so it's called the wet to dry. And then within the lip, there are little pillows. So you'll usually see little pillows. Hers are pretty even, not too distinct. You're more seeing a few pillows right up here. So that's the anatomy of the lip. Then you look at the ratio. You can close the ratio of the lips. Her lips are very much like 50-50, that the upper is not bigger than the lower. Usually in females, the lower is bigger than the upper. Usually a male lip is more 50-50. And within the last few years, it's become more popular for women to have an upper lip that's a little bit bigger. And so looking at hers, you also look from the side like this, how much they protrude. The upper lip probably protrudes more than the lower lip by a good, I want to say 1 to 2 millimeters if you look at her profile up close. Can you see that? And so then we want to ask her, do you want to keep that? How your upper lip protrudes more than your lower lip? You want to keep your current ratios?
Yeah.
Yeah. And then what is it that you would like to see? Anything different? Do you want to see exactly your lips but just a tiny bit bumped up?
Yes.
Okay,
And
I
then
would
also
agree.
just like how, the lines on your lips maybe a little bit more smoothed out, I would say.
Okay, now there's a couple of ways to do that. So different kinds of fillers. For a lip filler, you want something that's a medium bodied filler, not too thick, not too thin, and then we're just going to use a little bit of it to provide a little bit of volume. That'll bump out the fine lines a little bit because we're only using a little bit. There's also another filler called Volbella that's very, very thin, and we just use it to gloss out the lip lines, just to make the wrinkles go down a bit. Couple of things that are really important to know about doing the lips. One, lips have a lot of nerves, so ouchie, wah-wah. And that's why we asked you when you walked in the door, are you gonna be doing lips? And you're like, I'm not sure. Because when people are, we get the topical number on there right away. Okay. So we use a cream that needs to sit on there for a good 30 minutes. Usually what we'll do is send people home with the cream and they put it on 30 minutes before. And some people the cream is enough. And then some people, it's like, oh gosh, I still feel it even with the cream. We go in and we do a dental block like you're at the dentist and really numb it up well. Because we didn't have the cream on you, we'll do the dental block and that gives you great coverage. And the dental block is really easy to do and then you don't feel much at all. So one, ouchie wah-wah, gotta provide pain management. Two, the lips have a lot of blood vessels. They're most vascular area on the face, so they're the most bruisy area of the face. So you need to know, just time your appointments when you want to do your lips. Okay, I haven't got any photo shoots, job interviews, nothing where you'd be mad if it was bruised. So is this timing good for you?
Yes.
Yes. Okay, then the other thing that we like to teach people how to prevent the swelling and bruising, there are a few things that will make bruising worse. And those are things like ibuprofen, Advil, Motrin, aspirin. Have you taken any of those in the last week?
Does allergy medicine count?
No.
Oh, okay.
No. That's fine. So try and lay off of any of those anti-inflammatories like ibuprofen, Advil, Motrin, aspirin. The only one, if you guys have any pain needs for the week before you do any filler, the only one that's not a blood thinner is Tylenol, okay, acetaminophen. So what happens is all of those anti-inflammatories thin the blood, and when your blood is thin, you bleed, and when you bleed, you bruise. And then we gave you the complimentary arnica, and that helps prevent swelling and bruising and makes
Right.
people feel good. We give everybody that complimentary just so that they have good healing.
Nice.
I think that's it. Any questions?
No, actually no.
Do you want to do it?
Yes.
All right, fun. She's getting her first Botox and first filler. Woo!